mute my phone now and turn it over to you, Karina, and you can present away.
Sure. Thank you so much, John, and thanks everyone. It's so great to have an opportunity to tell you a little bit more about FXB and the FXBVillage model. We've certainly at FXB have gotten a lot out of being part of the movement for community-led development. So I'm always eager to hear your feedback, ask any questions. I may not always know the answers, but please, you don't have to mute your mic, so you could just jump in and ask any questions at any point. So this is hopefully more like a dialogue. But I'm excited to share a little bit more about FXB. So a little bit about who we are. We were established in 1989, and we're an international development organization. We work in 10 countries in Africa, Asia, and in South America. One of the most common questions we get is, what does FXB stand for? It stands for Francois Xavier Banud, a name of a young man who died about 31 years ago in a helicopter crash, and his mother, Countess Albina de Bras-Rovray, founded FXB in his name. And our initial work really focused on AIDS orphans and thinking about how we can strengthen the communities that we're helping and raising children left or orphaned by AIDS. And so that really explains our mission statement: to provide the poorest of the poor families with the tools and support they need to become self-sufficient and give their children a future. So FXB was really founded to focus on children and to help implement the Convention on the Rights of Children. But to do that, we do that through strengthening the capacities of the families, adults, caregivers, and the communities that are caring for those children. And we started, as I mentioned, our work with AIDS orphans in Uganda in 1989, and that was really what laid the foundation for the FXBVillage model, which is an integrated program that tackles various drivers of poverty simultaneously. And so for us, our work is really based on Jonathan Mann's paradigm that health and human rights is inextricably linked, and you can't, just solve someone's health issues without looking at education. And you can't. What's the point of sending a child to school if he's going to school hungry? That kind of idea. That really you needed to. Well, that we as all human beings, we need integral support, and that what we knew early on is that kind of giving out this kind of support wasn't enough. We had to build a sustainability component, so income generating activities were always part of our program early on, and the idea was that FXB would kind of help create certain enabling conditions, but really the families would be generating income that could then sustain the improvements. And since we focus on ultra poor families, we provide startup capital grants to start microenterprises and not microfinance. And in many ways, what we find is that our program participants then, through their income generating activities, are able then to access microfinance to grow their businesses and to grow their IGAs. So we currently implement 16 FXB villages in 7 countries, and that's really our core program. But in addition to the FXB Village model, we also have a host of other programs. Just to give a few examples, we have a really great entrepreneurship training program and an actual store in Myanmar where the handicrafts that are made are sold. We have a great vocational training program for at-risk youth in South Africa, and a great human trafficking prevention program in India. This is just to name a few. But today I'm going to talk about the FXB Village model, because I think that's really kind of the core of who we are, and also why I think we're part of this movement for community-led development, because we believe that it's really important to have integrated community-led development. So the FXB Village model is a graduation approach. And just to kind of back up and define a little bit about what graduation approach means, a graduation approach is an intervention that meets basic needs of ultra-poor families while investing in their capacities to become self-sufficient. And these programs can take many different forms, and many organizations implement graduation programs besides FXB. And so they usually have these core components. One is an asset transfer for the livelihoods component. So in many cases in rural areas, it's like an animal for animal rearing, and coupled with skills training to manage that asset, as well as a safety net or consumption support for a short period of time to stabilize the family to meet the basic needs, as well as savings promotion through the village loan savings groups, individual coaching, so life skills empowerment, and the health component. And different programs have kind of different degrees of different health services or links to health services that they provide. So this is the core graduation model. And so the FXBVillage model, it has all of those components in addition to a few others, which is legal aid. So as part of our program, we refer to legal services in some areas like child registration, so for children's rights, sometimes marriage certificates for like property ownership to facilitate that really helps the families. Housing is a big component around training and support for improved living conditions, and education, where we actually pay for, in a graduated manner, for school uniforms, fees, and supplies, and children are enrolled and have to attend school as to be part of the program for their families. And if for youth, it's in vocational training or reintegration in school, depending on kind of the situation. So as I mentioned, the FXBVillage model is a graduation approach. What does that mean? So for us, it's a 3-year program, and we gradually decrease FXB's support over those 3 years. So the first year, FXB covers 100% of the program's cost. By the second year, we cover 75%, and the participant contributes 25%. And by the third year, FXB covers 50%, and the participants are contributing 50%. And for us, the program ends in 3 years, after the 3 years, and the idea is that these families achieve self-sufficiency by the end of the third year through the income-generating activities, coupled with all of this other additional support that I didn't go into great detail, but that I mentioned around health, education, housing, nutrition. So how do we select participants? Clearly,
Karina? Anuk has a question.
It's from Roots of Development. I just have a quick question. I was wondering what was the rationale under the 3-year graduation time span?
That's a great question. I think it was just from experience. From 1989 to 91, we did many variations of the program in different communities in Uganda and Rwanda. So I think it's just what we saw, what worked. Was 3 years, and what the graduation programs that were studied by the CGAP Ford study, that kind of the standard graduation approach, are about 2 to 3 years. And the idea is that, just the theoretical framework behind it, that it has a beginning and an end. But I think it was like a decision made in the field for it to be 3 years. Thank you. That's a great question.
And, Karina, I have a follow-on question too. So, medical and educational expenses are a lot. Do these villages typically have the sort of the base costs of healthcare and education provided by the government services?
Yeah, so we don't provide the services, right? We link. So when participants enroll in the program, we help them enroll in government insurance that exists within the country. But as we know, doesn't always cover like all the medical expense. So FXB pays for any medical expenses that they incur during those 3 years that are not, let's say, covered by a clinic or an existing government scheme.
Great.
Just for those 3 years, but in a graduated manner. Mm-hmm. So yeah, we don't provide that service. It's something we link to. Mm-hmm.
Great, thanks. Okay.
Yeah. Great. Any other questions? Okay. So how do we select participants? We work with local governments, and we usually on a very local level, get a list of about 200 families that we interview through a selection interview process, like a household questionnaire, and we look for things like poverty, vulnerability levels, also motivation or willingness to achieve program objectives. I mean, the FXBVillage model doesn't really provide, the success of the program really depends on the participants to make changes in their lives, to adhere to treatment, to improve their housing conditions. There's really not a lot of sort of cash subsidies. In fact, only in most cases, the startup capital for the businesses is actually in kind, and I think only in very rare cases do we actually give out cash to the families to start their businesses. So there's really no, it's really what FXB does is create enabling conditions for families to be able to focus on improving their lives, on starting small businesses, on making sure their children are attending school. So it's really important that the families have a certain level of drive to achieve those objectives. For the program to succeed, another one is honesty and reliability, so reputation of the head of the household, and then in some cases where there's a high incidence of HIV/AIDS, number of orphans and vulnerable children in the household, but that's not always a criteria, just depending on the context. So we do a lot in those 3 years, as you saw in all those bubbles, but to communicate it much easier and clearer, we say that we focus on 5 interconnected drivers: nutrition, health, education, housing, and income. And within that, there are different goals associated within that. So clearly strengthening the economic capacities of vulnerable families, improving food security, eradicating malnutrition, enhancing access to medical care, and the rest that are listed here. But the idea is that no one goal is like more important than the other, that in a way you really need to meet all of these goals in order for the families to really become self-sufficient and hopefully sustainable, so like that they can sustain this level of improvement of quality of life. And so I think what makes the program successful and what's really important for the FXB as an organization, and specifically in the FXBVillage model, is capacity building. And it's probably what brings us to a movement like to a coalition like the Movement for Community-Led Development, is that FXB really focuses on building capacity at 3 levels: organizational, community, and then of course individual capacities. And so organizationally, all of our field offices, we have 9 field offices. They're all led exclusively by local staff, and to the extent possible, they're locally registered community-based organizations. And the idea is that really gives the organization autonomy, that these are strong local institutions that can meet the needs of their communities. I'm proud to say that I just found out this morning that our FXB China had just received the approval to be a locally registered CBO in China, and I think it's been a few years in the making, and I think it will allow us to have much more impact and embed ourselves even more in the communities, which is great. The program targets, FXBVillage model targets 80 to 100 families, but we know that, which is about 500 to 600 people depending where, but we know that these people live in villages and broader communities. So during the 3 years, we hold monthly training sessions for the entire community on some of the topics mentioned here. And the idea is that our impact kind of goes beyond the small group that we target for the program, but also it helps with the kind of behavior change that we hope that the participants take on as part of the program. And of course, the program itself is very intentionally designed to build social and economic capacities of the program participants so they can both sort of be empowered, feel like they can actually make these changes in their lives, and have the skills and the capital they need to be self-sufficient. So how do we know if what we're doing is working? Well, we're always asking ourselves that, and we know some things and we want to know a lot more. In terms of our like basic kind of monitoring and evaluation, we have a household questionnaire that we apply before, so right before the participants enroll in the program and at the end of the 3rd year. So we know what happens to our households during those 3 years. on average, across the 7 countries where we have FXB villages right now, we know that about 90% of those households achieve self-sufficiency by the end of the program. And we look at the household income and whether that income is above the national poverty line. We also have adapted the multidimensional poverty index and to suit our program when we pick the indicators that matter to us, and we also do that for, we know what happens to our families in terms of multidimensional poverty, you know, before and after the program. Of course, what we all really want to know is, well, great, at the end of 3 years, you know, the families increased in income and maybe had other improvements, but can they really sustain these improvements? When possible, we try to have external follow-up evaluations conducted on our programs. I'm sharing 2 here. One is was done in Uganda in 2014 by OFI that helped design the multidimensional poverty index. And I mean, I'm summarizing a whole research paper, but our former FXB participants, they were found to be less multidimensionally poor than their peers, even 3 years after the program ended. And another one is from Rwanda in 2007 that found that even 4 years after the program ended, children were still enrolled and advanced in school at higher rates than children who did not participate, and 86% of participating families were living above the poverty line. So 4 years after the program ended. We definitely want more evidence of sustained impact. It's just all, of course, you know, we're constrained by funding and things like that, but we're always, you know, that's a question we're always asking. And of course, we know for the countries where we have worked for 27 years, so Uganda, Rwanda, even Burundi, we know, like anecdotally, we know there are alumni groups that are formed, and we know we have some kind of follow-up on our participants, but obviously that's not the most rigorous way. And then our most recent study, oh, and this image is covering the text, but was just published in the International Journal of Public Health, and it's an assessment of our programs in Uganda and Rwanda that were funded in 2008 by PEPFAR funding, and it looked at 1,500 households that were FXB villages, and it assessed pre and post changes, and it also, the researchers did something interesting where the data was compared to national data compiled from the DHS surveys during the same time of the FXB Village programs, and an asset-based wealth index was created, and that was compared. This was the researchers and sort of our attempt to get at the sort of the comparison with the control group without actually having the control group, as we know, like the ethical issues that RCTs entail when we work with ultra poor, and also some of the funding, you know, that it requires to do a real RCT. So this was interesting. It was kind of experimental, and we looked at child and adult health status, access to care, household characteristics, food security, economic status, among other indicators. And I'm going to go through a few that we thought were interesting, but yeah, and then I'll share some reflections. So in terms of food security, we know that it increased at the end of the program from 5% to 88% of the households had more than 3 or more meals per day. So that's a pretty drastic improvement. In terms of health and HIV, the testing went to 100%, which makes sense considering that that's a key component of the program, is that all the household members get tested. In terms of water and sanitation, improved latrines increased from 67% to 99%, so we're happy about that. In terms of psychosocial well-being among adults, there are a number of questions in the questionnaire around sort of the way participants perceive themselves and others, and one that really stuck out for us, there was a question about whether participants had felt like they could turn to their neighbors if they needed maybe financial help, and that number increased from 27% to 98%, and we thought that was really interesting. So through the program, there was some kind of like communal social capital being built. In terms of school attendance increased, but really having adequate school supplies is what I think increased the most, from 7% to 97%. In terms of household economics, I mean, income is always so hard to measure, but we measured house ownership, that increased from 57 to 89%, and then participating in income-generating activities, that increased from 18 to 68%. So these are overall positive results. In terms of the results from the asset-based wealth index, now I can connect you to the researchers who did this methodology. That's a whole index they constructed, but basically FXB participants were better off at the end of 3 years than their peers in rural areas based on the DHS survey. That's what this graph shows. But it's I can connect you with the researchers who can go into sort of greater detail of how they actually calculated this. And so what are some of the conclusions for us when thinking about kind of graduation programs and programs that also integrated and that also empower communities and build capacity? So we can see that direct support for basic needs does stabilize the household if it's done in a graduated and time-bound manner. In terms of economic capacity, you really need that combination of the startup capital as well as skill training and savings promotion to strengthen economic capacity. We think a lot about resilience and what will make our household kind of resilient to shocks and other kind of unexpected events in the future. So we think it's probably a combination of individual sort of well-being, and that's through the coaching that's provided in the program, and a stronger community networks. So there's a collective income-generating activities that they do, as well as the village savings groups that create those community networks. And this is just summarizing all the FXB villages over the last 27 years, 168 villages. And you can download the FXB Village Toolkit and Planning Guide and access the framework, all of our sort of the methodology, all the tools we use, actual forms to implement an FXB Village, or to think about how to integrate your existing programs, or just to browse. We would love for you to download and reach out to us and hear your feedback and see how we can be useful in making and helping you. And then connect with us on social media. Thanks. I would love to take questions or thoughts. I mean, this is really exciting for us to have a chance to present to this group and get some great feedback.
Great, Karina. I'm sure there's a bunch of questions. Liz, were you raising?
No, I'm just saying that everything we have. Hi, Karina. It's Liz Fanning at Core Africa.
Hi, Liz.
Hi, how are you? Heba's here with me as well. Hi, Karina.
Oh, great.
Hi,
Heba.
We were just talking about how we have the similar impact, monitoring and evaluation goals and shared approach to development. So this is great. Are you guys in Senegal at all?
No, we're not. But we are always open to expanding to new countries.
I had a question, Karina. This is John. What are the in an FXB village, the ultra poor are direct program participants. What percentage typically of the entire village population are participants?
Well, it would vary, but FXB Village, so the program is designed to help 80 to 100 families. So
Right.
it's usually a small percentage of a village. I mean, it depends. It varies so much. We also work in urban areas. So the word village is a little misleading because we're just referring to a cohort of families that we help. But I would say it varies. But what we do is in places where we know we kind of have secured funding, we'll out of, like, let's say the 200 families that we interview and the 80 or 100 that get selected, then we kind of have like our next 100 probably already lined up. We try to stay in the same geographic or actual physical village when possible. This kind of helps in terms of like community cohesion, and also just for impact as well. It certainly helps when you have, a lot of FXB
Right.
villages in one area where you have people who are, productive and are doing great things. Mm-hmm.
And I can send a whole. this is a fascinating methodology, and I really appreciate the presentation. What is the sort of staffing of it? How many staff per, I mean, what's the ratio of participants to staff member? Is it sort of one program officer per village, or multiples, or do they share? Kind of what's the staffing level?
So at the core of the FXB Village are 3 staff members. So in an ideal world, social worker, a nurse, and like a logistician. That's kind of the, okay. Probably when the program started, that was sort of like the 3 key kind of people to really, like the field workers in a way. But then the actual sort of beyond that, staffing varies so much based on the country. But let's say in Rwanda, which is probably maybe our biggest FXB Village operation, there's like a regional project manager, and then there's like a central monitoring and evaluation officer. So at the core, ideally, you need like 3 field people to help 80 to 100 families. But of course, in reality, we always adapt to funding needs and other constraints.
And then after those 3 years, do they just move, or do they take another group of participants?
So usually take another group. FXB, you mean FXB country office, right?
No, I mean the 3 staff who are working on the village.
Oh, yeah. Usually they take on another group of participants. So when we do fundraising, we try to secure funds for more than one FXB village for that reason, because of the staffing changes that it would, what it would mean for people to lose, a job, and the continuity and the learning. And usually, I would say in most cases, we probably have secured funding for at least 3, I would say at least 3, if not a lot more, before we start anywhere. So we're looking at starting in Sierra Leone, and so our condition is we won't start until we have funding for, at least 2 or 3 FXB villages for that staffing reason.
And and you mentioned that you're working in urban areas. Are you working predominantly in urban areas, or a mix?
It's a mix. It's definitely more rural areas, but we work in Kigali in Rwanda, and also in Barranquilla in Colombia, and Bogota, so both urban areas. But it's still predominantly rural. But it's been interesting to work in urban areas when you think about micro enterprises and income generating activities. They're going to vary. That's probably the biggest variation. Also, like the loan kind of savings group don't always work in urban areas, so that has been adapted. It's hard, community networks are just weaker in urban areas. What else? So I guess sometimes I would say those are the 2 biggest sort of differences that we find between urban and rural.
Got it. Anya?
Yeah, hi, Karina. This is Anya from Concern, and we implement these graduation programs in various countries. And I suppose one of the things that we found very similar successes to what you've talked about here, but the actual cost of the program is incredibly high, and I suppose the difficulty in getting donors to support them. And we tend to do a 5-year program rather than the 3-year you talked about, but we're walking the halls of donors at the moment, sort of presenting results in the hope that we get further support. And I'm wondering if you've done the costings for your graduation model.
Yeah, so we know that it costs, it varies between $125 and $230 per person per year, which is about $300,000 for a village for 3 years. It is expensive if you compare it to programs that maybe don't offer any of the cash subsidies or anything that that just offer training. And there's a graduation program in Uganda, AFSI, that FXB is actually one of the implementing partners for. That is just that's just training, and that's half the price per person than our program. But I guess it's hard because they're so different. But we definitely face the challenge of getting funds for an integrated program, and also because the family, it's a small. Each program serves 80 to 100 families, 500 to 600 people, and sometimes donors want a lot more, but they want more numbers for their dollar invested, then this program is designed for.
Right. Anouk?
Yes. So, in the context of the rural areas, have you experienced some internal conflicts between one household or some household in a village that are chosen in the project and those that are not? That's one question. And my second question is, one of your criteria for eligibility is reliability and honesty, and I wanted to ask how do you assess that?
So in terms of the first question, probably both of them, I'd say so for FXB, as I mentioned, so the country offices are locally led, but also like what that really means is that we're able to build really good partnerships with local organizations, local government for sure, to help identify the families. And so what I've asked this question to all of our country office directors, and they say across the board, whether it's India or Rwanda, wherever it is, the level, like the staff is so embedded in the community, and the program selection is done in a way that it really does benefit the neediest families. That there must be individual cases of tension, but overall there's not. And because of the community-wide trainings, and because we know that the next FXB Village will help the next needy 100 families, so of all these kind of confluence of factors, there's really not kind of any like massive, or prohibitive kind of tension. But obviously that's generalizing it. But I would say all of our country directors have said that regardless of the geography. So that's how, like, I think that being embedded in the local community, so that I would say that helps, and that really solves that. And then the reliability and honesty, that's part of it as well, where the staff who do the selection interviews, they're often from the community, or very like the general community, and so they can sort of help us assess that. So it's for, like, when I was in Rwanda and I went around with the local staff, all of the social workers had been with they were all young people, and they had been with FXB for more than 5 years. They knew the communities really well. I think they knew the people really well as well. So that I would say that we somewhat rely on their, on their assessment. But I'm sure there must be, also cases where, there's either misjudgment or, not proper assessment. But really, I think that goes to the core of this group, right? Like the community-led piece is really critical. Not just sort of for effective program implementation, but to actually, have the impact we want to have. I think there's some questions.
Yeah, you've got some questions on the chat. I know Sarah Belfort had a question about selection of villages and families, and Vera had a question about gender considerations in the model, and also whether your funding is for the whole model, or do you sometimes get funding that's just for a sector?
Okay, so I'll start with the gender considerations. So what we find is that most of the households that are selected based on the criteria are women-led households. So that I would say that is generally true, but also a big part of the program is to work with the family. So a lot of like the coaching and the psychosocial support will focus not only, let's say, on the head of households, be it a woman, but also on like communications, or if there's violence, between in a marriage and things like that. So I definitely met graduates where it was like the married couple was like proud of the accomplishments they made together during the program, even though it may have been like the woman, kind of officially enrolled in the program. So there's not, I would say there's not like a specific gender focus, but there are a lot of women-led households, and we do a lot of sort of training on women's rights and things like that I guess have that gender component, but we work with the men a lot also, because that will really help the success of those families. And then if investors finance specific programs, so we work really hard to get funding for our full FXB Village, and we've been like the 168 are full FXB villages. As you can imagine, there are donors who will just say, but we really just want help, and we don't. usually do that for like smaller donors, but I will say that in Rwanda, like USAID said, oh, you're doing wonderful work, but we need nutrition. You know, we just want you to give, you know, nutrition training and support. And I mean, FXB Rwanda, you know, is not going to turn down funding from USAID. So, you know, so we do it, but it's still it's the staff that have that kind of integrated approach. And so we try to embed some of the other program components, even if it's just focusing on one sector, but I would say that happens very rarely. And then I don't know if that answers it.
That actually leads to my question.
Okay,
building on what Vera said about the funders, and you talked several times about the challenges funding, is getting funders to support a community-led approach as opposed to a funder foundation-led approach, which is what they want. They want specific impact measurements on education or healthcare or, you know, water and sanitation. And your approach, like our approach, is about going in and listening and asking people. So you can't get that funded in advance. You don't know what you're going to be doing. What's the answer to that? That's for everybody, not just for Karina.
Well, I think, yeah, I think that's our central reason for being, is to transform the entire funding paradigm for poor communities around the world. So we'll go into that in depth in the second half of the meeting.
Okay.
But Karina, if you do have the answer, you could save us all a lot of time.
Yeah, really.
Well, let me tell you.
Thank you. Okay. Any other questions for FXB and Karina? If not, I'm going to push the button that stops the recording, and then this will be available on our website, you know, in an hour or so. And I'll send out an email with the link so that people can share it. Let's see, where is that button?